Rinvoq is a Janus kinase inhibitor. It works inside your cells to block certain signals that are thought to cause inflammation. Indications. Rinvoq is used to treat adults with moderate to severe rheumatoid arthritis, active psoriatic arthritis, moderate to severe ulcerative colitis, active ankylosing spondylitis, and active non-radiographic axial spondyloarthritis. It is used when medicines called too many necrosis factor blockers have been used and did not work well or could not be tolerated. Rinvoq is also used to treat adults and children 12 years of age and older with moderate to severe eczema, atopic dermatitis that did not respond to previous treatment, and their eczema is not well controlled with other pills or injections, including biologic medicines, or the use of other pills or injections is not recommended. How to use. Take Rinvoq exactly as prescribed by a doctor, follow directions in a prescription label, and read all medication guides or instruction sheets. Your doctor may perform tests to make sure you do not have tuberculosis or other infections. Take Rinvoq tablets with a full glass of water. Take the medicine at the same time each day, with or without food. Swallow the Rinvoq extended release tablet well and do not crush, chew, or break a tablet. You may get infections more easily, even serious or fatal infections. You will need frequent medical tests. If you've ever had shingles, herpes zoster, or hepatitis B or C, using Rinvoq can cause these viruses to become active or get worse. Usual adult dose for rheumatoid arthritis, 15 mg orally once a day. Usual adult dose for psoriatic arthritis, 15 mg orally once a day. Usual adult and pediatric dose for atopic dermatitis, 15 mg orally once a day. Usual adult dose for ulcerative colitis. Induction dosage 45 mg orally once a day for 8 weeks. Maintenance dosage 15 mg orally once a day. 30 mg once daily may be considered for patients with refractory, severe, or extensive disease. Usual adult dose for ankylosing spondylitis 15 mg orally once a day. Usual adult dose for non-radiographic axial spondyloarthritis 15 mg orally once a day. Contraindications. Taking Rinvoq can increase your risk of life-threatening medical problems, including serious infections, a whole or arterial digestive tract, a heart attack or stroke, blood clots or cancer. Tell a doctor if you've had a weak immune system or chronic infection, such as tuberculosis, shingles, HIV or hepatitis, any type of cancer, kidney disease, a kidney transplant, or if you are on dialysis, diverticulitis, an ulcer in your stomach or intestines, heart problems, a heart attack, stroke or blood clot, high cholesterol, or if you've ever smoked. Warnings. Rinvoq affects your immune system. You may get infections more easily, even serious or fatal infections. Call a doctor if you have a fever, chills, aches, tiredness, cough, skin sores, diarrhea, weight loss, or burning when you urinate. Taking Rinvoq may increase your risk of life-threatening medical problems, including serious infections, a whole or tear in your digestive tract, a heart attack or stroke, blood clots, or cancer. Tell a doctor if you have a weak immune system, diabetes, chronic lung disease, or an infection such as hepatitis, tuberculosis, shingles, or HIV. Also tell a doctor if you've ever had diverticulitis, an ulcer in your stomach or intestines, cancer, heart problems, or a history of smoking, heart attack, stroke, or blood clots. Rinvoq side effects. Get emergency medical help if you have signs of an allergic reaction to Rinvoq, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Some people taking Rinvoq have developed heart attacks, strokes, or serious blood clots. Stop taking Rinvoq and seek emergency medical attention if you have sudden shortness of breath, chest pain or pressure that may spread to your jaw, shoulder, arms, or back, nausea, vomiting, cold sweat, a lightheaded feeling like you might pass out, weakness on one side of your body, slurred speech, dripping on one side of your mouth, pain, swelling, or redness in an arm or a leg. Call a doctor at once if you have fever, chills, night sweats, constant tiredness, wheezing, trouble breathing, severe or worsening cough, increased urination, pain or burning when you urinate, unexplained weight loss, lumps in your neck, armpits or groin, signs of shingles, flu-like symptoms, tingling or painful blistering rash on one side of your body, a whole perforation in your digestive tract, fever, severe stomach pain, diarrhea or changes in bowel habits, signs of hepatitis, loss of appetite, vomiting, stomach pain, upper right side, dark urine, clay-colored stools, jaundice, yellowing of the skin or eyes.